Welcome to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. Today's example is a 15-year-old dog with seizures. Once you have reviewed the radiographs using your systematic approach, then you're ready to watch this video. This is an example of a case where we performed thoracic radiographs as a screening step. The dog presented for seizures, and it was thought prudent to make thoracic radiographs to screen for underlying disease prior to proceeding with additional diagnostics, which could include MRI or CSF tap, for example. As you can see on this radiograph, we have found something significant indeed. This is an example of a case where many of us will be able to see the main finding right off the bat. Remember, in those cases, you have two jobs still left to do. The first job is to use your radiographic skills to determine exactly what this finding is, where it's located, and what it could mean. The second job is the harder part, and that's remember to always look at the entire radiograph. So, let's start by looking at the angle with which this soft tissue mass in the left caudal thorax contacts the body wall. I can see that the angle that it reaches here is rather sharp or acute, and the same is true for its caudal margin. This is the classic appearance of a pulmonary mass that contacts the pleural surface. We have seen in another case how this angle will be much broader and look quite different when we have a body wall mass that's displacing the lung. Let's look at this on a couple more views. I'd like to show you the difference in the way this appears between the right lateral view and the left lateral view. Recall that when we're looking at our right lateral view, we expect to see improved features of the left lung. Why is this? This is because on the right lateral view, the right lung can become a little bit hypoinflated and atelectasis due to recumbency, but the left lung is better inflated, better aerated. Therefore, things tend to show up much better. As in this case, on the right lateral view, this mass that we know is in the left lung is really well defined, and we can see it quite clearly. While we're here, I'm going to point out to you a couple incidental findings. In particular, I'd like to show you that there's a few little wee osteomas here in this case. Why am I calling these osteomas? Well, you can see that they're located peripherally in the lung. They have an opacity that's consistent with mineral, and they don't line up with pulmonary blood vessels. So that would be highly consistent with osteomas. If we were to compare that to something that may well be a pulmonary blood vessel, let me show you the difference. Here you can see I'm tracing a pulmonary blood vessel, and at this point here, there's a branch from that blood vessel that goes dorsally. Do you see how adjacent to that branch, there's a soft tissue feature that's round? That is much more likely to be a pulmonary blood vessel end on. These ones, however, have the features consistent with an osteoma. I'd like to show you the mass on the other lateral view for comparison. So have the right lateral view in your mind, and here comes the left. In this case, this is quite a significant mass, so it still shows up quite well, but you can see that it's not as obvious on this view or as well defined. And that's because on the left lateral view, the lung that's adjacent to this lesion is going to be a little bit compressed, making the margins a bit more fuzzy. One more thing, as we did our complete systematic review, we would have noted that there's also this feature here, superimposed on the liver. The shape of this is highly consistent with sediment in the gallbladder. Another possibility in this dog is that this could be a summation of a skin nodule. There's quite a bit of lumpy, bumpy surface contour to this dog's skin. In an older dog, these are often due to these are often due to lipomas, but this would have to be correlated with palpation and if indicated, sampling. So here we have a left caudal lung lobe mass, which is well defined. In a patient of this age, I would have a neoplastic cause as the highest on my list, but sampling would be needed for definitive diagnosis. This can be possible from an intercostal window with ultrasound guidance under skilled operation. So be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.